Welcome to the Making Kids Count podcast, brought to you by Kentucky Youth Advocates, where we sit down with policymakers, community leaders, and youth to discuss ideas to make Kentucky the best place to be young. This is Shannon Moody sitting in for Terry Brooks today. I'm the Chief Policy and Strategy Officer here at Kentucky Youth Advocates, stepping in for Terry, and I'm really honored to be able to do this today. Thanks for tuning in to the Making Kids Count podcast. Today, I'm joined by some key partners and experts in the realm of child health, including Allison Adams, who's the president and CEO of the Foundation for a Healthy Kentucky, and just such a respected partner, really strong understanding of children's health on the ground, and is now in the philanthropic space, leading the charge when it comes to making sure that all of the kids across the Commonwealth are healthy and thriving. And I'm also joined today by Bruce Lesley, president of First Focus on Children, a national organization based in DC. And First Focus is an organization that Kentucky Youth Advocates looks to often to understand what's going on in kid advocacy space across the Commonwealth or across the nation. And we also utilize Bruce just on his analysis and smarts on a pretty regular basis. So he is on speed dial for us pretty often. And then finally, we're joined by Alicia Whatley, who is the Senior Policy and Advocacy Director at Kentucky Youth Advocates, my colleague, and really glad to have you all on today. So we are discussing the Trump administration's Make America Healthy Again movement, also known as MAHA, led by the U.S. Health and Human Services Secretary Robert F. Kennedy Jr., and with our guests, we're looking at this at both the national level as well as the state level, and its potential impacts on child health and well-being in the immediate and into the future. So looking at MAHA today, just out of curiosity, Allison, can you give our listeners just a quick download on the national MAHA movement and the main areas of focus as it pertains to kids?
Sure. And I just want to say thank you to the Kentucky Youth Advocates for having me on the guest of the podcast today. I really appreciate it. And like Shannon said, the national MAHA movement is a current White House administration initiative. It stands for Making America Healthy Again. And supporters of it say that it's working to address chronic illness in the United States. And so when we think about what we need to do to address or reduce chronic illness, we usually expect a set of policy initiatives or redirected funding to begin to address what we know are causing people in the United States to be chronically ill. And then we have the recently released Make Our Children Healthy Again strategy report that came out of the MAHA movement. And it points to 4 areas that it claims are driving the rise of chronic illnesses in kids. So for our listeners out there, we are diseases or chronic illnesses that used to be seen primarily in older or middle-aged adults or younger adults, we're now seeing they're cropping up in our kids population. So diseases relative to overweight, like diabetes or high blood pressure, we're seeing those kind of chronic illnesses, spiking up in our nation's children. And so these 4 areas, poor diet, lack of physical activity, and chronic stress, exposure to chemicals, and what MAHA is causing over-medicalization, which is a big word. These are areas that I would say aren't revelations. For those of us who've been working in the health advocacy space for children, we have been calling on, or I would say warning of, the poor diet, lack of physical activity, and the chronic stress that children are exposed to, as well as, at least from our perspective and, working with Kentucky Youth Advocates, if we talk about the exposure to chemicals, we've been seeing the rise in exposure to nicotine and nicotine-like products that we've been advocating for. So again, these 4 areas aren't revelations. What I see is that the problem in this report, so I can agree with the 4 areas, is that it's lacking in when it comes to specifics and evidence-based strategies towards working towards improving kids' health. So just making claims and then not having some solution just really doesn't set well as a full report for me. And the other thing that it just doesn't direct any funds towards addressing the issues. Again, advocates like myself who've been doing this for several years, we've been asking for policy changes, money redirection, so that we can make evidence-based improvements or inroads in addressing children's poor diet, lack of physical activity, and exposure to chemicals. And so I'll just finish with this, the wrap up of what MAHA is that, I do think that while the four areas have good merit to them, I think that the report is just missing the mark on getting to the root causes of these issues and, what are the solutions. And, just we know what works. We know the Foundation for Healthy Kentucky has done past initiatives that when you combine right investments, strong community partners, supportive school environments, and then policy, we can see real change. Kids will eat better, they will move more, and we can, build that foundation for a healthier future.
So, Bruce, I saw you nodding your head. I'm curious to see what first focuses Lane isn't within this, and where are you all seeing the potential changes or your all's response to what has come out so far?
Yeah, absolutely. Well, first, thank you all, Kentucky Youth Advocates. We so admire and respect all the work you do, and so thank you for having us on today. And I would say mostly, I would say that I second so much of what Allison said. I think that there's I think that the MAHA movement is responding to some very legitimate concerns that parents have, and parents are concerned about things about such as rising anxiety and depression in kids, some chronic illnesses, as Allison spoke to. Asthma, learning loss through the COVID period, issues around ultra processed food, and kind of just even this sort of general feeling that the system is broken for kids and families. And so those are all legitimate and absolutely things we should address for children and families. I would say what is just a giant miss is I think the report, the Making America's Children Healthy report, and recommendations, is that it really largely did very little. It provides very little in terms of um, solutions to these problems. In fact, I would argue that it really stokes fear, and in things like vaccines, I think, and you saw a result the other day about the press conference around Tylenol and in pregnancies. I don't think any of that is helpful at all. I think if it was really science-based, you don't need the president and the secretary, who are not medical professionals, pontificating on how they feel about, males, by the way, pontificating about what, medical science and what women should do during pregnancies. It was kind of cringy, to be honest. And I also think that it really undermines trust in a disturbing way, and it leads families to this position of being atomized. And what I mean by that is that it's sort of left up to everybody for themselves. And I think any of us who are parents would say, you rely upon your pediatrician, you rely upon your teachers, your school counselors, and those people are experts and they are partners with parents. And what we shouldn't be doing is creating sort of a distance and a stiff arm of them when they're partners to parents. And so I think that that's a really huge disservice um, that I would say Secretary Kennedy and this report from HHS really have created. And I would argue that there's, what's upsetting is that the things I talked about, the very legitimate concerns that parents have, there are solutions. There is an agenda out there for parents, and that what people need across this country and in Kentucky. And I think it's obviously things around, access to medical care and doing things to address the children's mental health crisis, It's improving pediatric readiness standards in healthcare. We have a situation in this country, for example, like emergency rooms are not pediatric ready. And so when people go to an emergency room and there's not pediatric expertise there, they actually don't provide appropriate services for kids. So parents have that expectation if you go to emergency room. So it's things like that. I'm very disturbed that the administration is slashing support for children's mental health, slashing support for medical research. So a lot of those things, I just think that they're heading backwards in a lot of ways on things that actually what kids and parents need.
So it sounds like a lot of missed opportunities for like really legitimate concerns around how our kids are being impacted environmentally, nutritionally, also some of the things that we're seeing as far as health outcomes much earlier on when it comes to chronic disease, and then also potentially harm. We're concerned about what some of the conversations and the narratives are happening around what's either maybe confusing parents or could cause a misunderstanding of what the reality is and what the science is telling us. And, I think there's a lot of hopefulness sometimes when we develop these task forces, as far as like we want to see solutions, we want to see those recommendations move into play for any task force in general. And then, unfortunately, it sounds like we don't have really clear solutions that are rooted in what our research tells us. Now, I'd like to talk a little bit about how we're seeing some parallels with the development of a task force in Kentucky. In the Kentucky General Assembly in the 2025 legislative session, a Make America Healthy Again Kentucky task force was developed, and that task force began convening this summer. So I want to talk, Alicia, a little bit to you about what you're seeing as far as like what's manifesting in that Kentucky task force. Are there similarities? Are there differences? What is that looking like?
Yeah, thanks, Shannon. Always happy to be back on the podcast with some of our amazing guests today. And yeah, so as you shared, pretty soon after the Trump administration came into office in January and sort of the national MAHA movement started to take shape, Kentucky legislators took that step to establish a task force here in our state around this issue. And so this is operating just like other legislative task force do in our state. And so for listeners, if you're not as familiar with that type of meeting, it's made up of folks from both the Kentucky State House and Senate. So we bring members of both together, and they meet pretty much every month between June and December is typically what they're doing. And they are mostly just gathering information. So they set up agendas based on topic areas that they want to hear about, and they bring in experts and folks to kind of testify and just give committee members information. Because most of them are not experts on a lot of these things. And so they're just kind of learning and trying to dig into the issues that are of interest to this task force. And so, like you said, it is sort of an extension of the national MAHA movement in a lot of ways. They largely have the same stated goals as what they want to work on at the national level. And so the purview of this committee is pretty broad. I mean, they could really be digging into pretty much anything that impacts health of Kentuckians. They can kind of go in any direction they want. But what we've seen so far, they've met a few times this summer, and what we've seen is really a focus in on nutrition. I think that is something that has been, the co-chairs of this task force have talked a lot about nutrition being of interest, maybe of the biggest interest among all of the items that they could be covering. And so far, their meetings have talked about, they spent a lot of time talking about programs that folks in Kentucky access to get nutritional support. So that's things like the Supplemental Nutrition Assistance Program or the SNAP program. Also things like school meals, where a lot of kids are accessing a whole lot of their meals throughout the year and throughout the day. And then they've also kind of tried to take a broader look, I think, at nutrition and what it looks like in our state. So what does nutrition look like in terms of impact on overall health for folks? We know that our health outcomes in Kentucky are not great on a lot of measures. And so they've talked a lot about how is nutrition kind of impacting that or leading to some of the health outcomes that we're seeing. And then also, what does nutrition education look like in our state? So they're talking a lot about are people equipped with information and knowledge they need to make good nutritional decisions? And do they have access to healthy foods that are affordable and accessible in their communities or in their schools? So they've really honed in on nutrition. We know that that is a big interest area. And I think that the task force in Kentucky provides some opportunities that might be a little different than what we're seeing at the national level. This is certainly a more accessible arena to talk about these issues at the state level than it is to, call the national administration and talk to them about these issues. There are folks who are representing Kentucky communities and who are, our own representatives here on the ground that know about what's happening in Kentucky that are looking at these issues. A lot of the recommendations that are coming out from the national movement are really federal changes, things that are regulated by the federal government, and Kentucky can't make a lot of changes on a lot of those programs ourselves at the state level. But this task force, I think, provides some opportunities to think about taking those tenets that, again, a lot of folks are really in agreement on. Like, we need to have better nutrition, we need to have more exercise and movement, we need to find ways to reduce chronic disease. What can we do at the state level that feels a little bit more tangible and accessible? And I think that that's really the opportunity for this task force to take those tenets and figure out what that looks like on the ground here in Kentucky.
Yeah, and I will echo what Alicia says in respect to where the Kentucky Task Force is heading. And, I agree that nutrition is seems to be their main focus. And having had the opportunity to testify in front of the committee, I was pleased to have the invitation to just to give the background, to level set on the data, like where where Kentucky ranks, like Alicia said, is not great in our health outcomes. And the fact that the task force is looking at where are the numbers originating from, and what policies and what suggestions and areas of improvement we can make to address and move the proverbial health needle in the right direction. And I think that the opportunity that was afforded to me to really bring in the discussion that we've all heard, but really haven't had a true opportunity to converse about the social determinants of health, or the social drivers of health, and what policies and opportunities that we need to make sure that we have in place for Kentuckians. And Alicia, just thinking about it, and Bruce and Shannon, just thinking about, we hear a lot about accountability, individual accountability, and why aren't we just making the right choice? We all know it's the healthy choice, and why aren't we just making it? And we had the platform and the opportunity to really talk about food deserts, to really talk about the lack of familial education on how to cook, what to cook, how to make sure that you can maximize your dollars. And we forget when we're talking and we're making policy that many of us come from a privileged area where we've had trusted adults, or we've had the benefit of someone taking us under our wing and teaching us to cook or teaching us to budget. And so this gives us an opportunity to have some quality discussions about where there is systemic lack in community accountability. And I'm not against individual accountability, but we really need to focus on is the community accountable to making sure that when they're ready to make the healthy choice, it's there for them to make.
Yeah, and I would add a couple of things too that I think that are important for Kentucky here is that the policies that the federal government has imposed and will be coming down to Kentucky really do hamper the ability of the state to do its job and to really try to improve child health. Because there was over $1 trillion in cuts to Medicaid and SNAP over the next 10 years that came down from the so-called One Big Beautiful Bill. And the consequences of that is millions of children will lose health care across this country. That's just a fact. and pregnant women as well will lose access to care. I mean, some of the barriers that are imposed have to do with bureaucratic administrative requirements that are really going to constrict both coverage and access to care. So those are the federal government's putting Kentucky at an enormous disadvantage, and you're going to see real huge threats, and particularly to like rural clinics and hospitals and things like that I think are deeply concerning. But also the feds did some really, like per the points that Alicia and Allison have made, is the feds have also done, there's some really unique programs. Like, for example, there was the farm to school programs. So if we don't think that school meals are healthy, there was a really innovative farm to school program where basically schools were getting access straight from farmers, healthy and fresh, food and vegetables and things like that. And that program was eliminated by the administration. So if we're worried about ultra processed foods and things like that, that was a huge step backwards. And so again, I think some of the federal policies say one thing and are doing the exact opposite. And it really does, I think it really does hamstring Kentucky's ability to take steps forward, because I think a lot of the focus is going to unfortunately end up being like, how do we play defense so things don't get worse? So it's not going to be an ability to have an agenda of moving forward in some ways. Instead, we're really taking a lot of steps back. And I really like even the vaccine stuff, like to create vaccine misinformation. We now have over 1,500 cases of measles spreading across this country. That is not progress. And even in the title, Making America's Children Healthy Again or whatever, that's like moving to the past. Well, that's not necessary. Is that the direction we want to head? I don't think it is. It's in the past, we had we had cases of vaccine preventable illnesses and lower longevity, and kids died at higher rates as infants, and maternal mortality rates. So that's not the direction we really want to head. And so I'm really concerned that the federal policies are really pushing states like Kentucky backwards before you can move forward. And that's not what we want to do.
Yeah, I know, especially as we head into our next legislative session in 2026, which is also a budget session, we know that our legislators are going to have to make some tough decisions when it comes to the budget. We're hopeful that we can maintain a lot of the nutrition programs that are in place, but I know that they're going to have some tough decisions ahead. And we'll have to look at, if they're maintaining that, what doesn't get to be maintained, or what we may lose. So that kind of relates to another question that we had for the team as a whole around, I think we talked a little bit about worries, but I'd also be curious to see what other worries folks might have. And then also what hope when considering the growing reach of the MAHA movement. What does that bring up for you all?
I'd be happy to jump in first, Shannon. I think that for me, it's kind of echoing some of what Bruce shared. In Kentucky, our legislators are going to have some tough decisions in 2026, and we're kind of preparing for that. So I think one of the biggest worries for me is just that we spend a lot of time talking about the MAHA kind of tenets and movement and what that looks like. And there's a lot of agreement about wanting to make some changes to health in Kentucky. And just that we aren't able to get any real tangible changes for Kentucky kids out of that in 26 because of some of the challenges that the federal changes have set up for us, but also just our environment generally. There's some other things kind of compounding with that in Kentucky. As we really continue to come out of COVID seasons and COVID budget sessions, and seeing less dollars in Kentucky than we have in previous sessions because of some of the COVID money ending. And so I think that in Kentucky, we have some really unique challenges to improving health outcomes. It's been stated that we don't have great health outcomes as it is, but we also have a lot of folks living in poverty and facing challenges in their communities and in their neighborhoods. And we have a lot of rural areas of Kentucky. So there's a lot of things that we need to consider when we look at improving health outcomes. And there's, I think, opportunities that can really align with the MAHA agenda, the solutions that we could put in place that align with the things that MAHA is pushing and wants to see happen. So I think that my biggest worry is that our legislative members won't be able to find the consensus to move those things forward, because I think there's a lot of different ideas about how do we implement those changes that align with the MAHA tenets. And so I think that that's kind of, for me, one thing that's on my mind is just how do we get to actually seeing some action on it in 2026? And what would that look like? So that's one thing for me, and I'd love to hear from Allison or others, kind of what you're thinking for Kentucky as well.
Alicia, I have the same fears and hopes. I think that you said it very well, but when I think about the worry or the fear is that for those of us who have been in this for a while, Bruce and we have gray hair, so we've been in it for a little bit. When I think about we know that there's evidence out there. We've seen demonstration projects. We know what works. We know that things can just be tweaked a little bit, to have even more of an effect. But like Bruce said, those things seem to be being rolled back. So the worry is that what we know is working, instead of pouring more dollars and resources into those programs to work, we're calling them a failure and we're doing something different. And when we've been advocating, we can't always say that these programs have had the global or the Kentucky outcome we're looking for. But if you look at the populations that, like SNAP education, who received the SNAP education, who were implementing the tenets of the education, you see the results. The participants have positive outcomes. What we don't have is the economy of scale of participants that we need in order to have that. And the reason is lack of resources or lack of accountability to attend the education. So there is opportunity. They just, they seem to be, instead of moving forward, we seem to be like, that didn't work, and so let's just not do it anymore, instead of, this has worked for a subset of population. Let's see what it looks like with more resources and more policy directions toward it. And I think that the other thing that is, just to tack on what Bruce said, is I do worry that we have more fear and mistrust being sown in this movement, in this because we're not talking about what has worked and what is working and why it worked. We're just talking about that all of a sudden these things that were truths in public health, like our vaccine framework, our vaccine schedule, like Bruce said, acetaminophen, one of the only pain relievers that pregnant women can rely upon, is now suddenly a bad thing and without evidence. And then, here in Kentucky, and I think across the nation, we're still fighting the fluoridation of water battle. And like Alicia said, in poverty-stricken areas, where, even we have poor dental hygienists and dental access here in Kentucky. And one of the proven public health models is, the appropriate amount of fluoridated water does in fact reduce dental caries, which then, the health of your mouth is the health of a child. And so, so those things are, worrisome as those are gaining traction through the MAHA movement, where we in Kentucky have been working, playing defense on those strategies. But what does give me hope is that we're talking about health issues in kids. And so, this is also something that, being able to just talk about it, and advocates being invited into the room, and getting momentum of like being able to share or redirect our messaging, that can make some aha moments where light bulbs come on of like, maybe this, is something that we can contribute and move forward. So I think from a statewide perspective, I'm excited. I was excited, still am excited about the MAHA task force as being a conversation starter with policymakers, and really trying to figure out, what resonates to improve the health of Kentuckians and investing in children's future. And so, I've said this before, I think it's an opportunity that, kids want us to invest in systems and not the symptoms.
Yeah. So I love what Alicia and Allison have said, because I think that anybody who works in child advocacy will say, um, unfortunately, kids are often the afterthought and they're invisible in these discussions. So I think that is the biggest opportunity, is that it gives the opportunity to have people actually have the debate and focus on kids for a moment, because so rarely do they. Kids are almost a quarter of the population and get about 2% of the attention. So that is a very good positive, that there'll at least be some focus. The hope is that people, when they think about the problems, they put together better solutions than what we're seeing from MAHA at the federal level. And so a couple of things that I would say is, instead of going backwards on things like fluoride, I mean, it's one of the leading, you know, dental caries is like one of the leading reasons why kids miss school even. So if we are worried about learning loss, then that's actually a symptom of one of the problems that is happening. And we shouldn't be going backwards on things like that. And so my hope is that as policymakers hear about the problems, they connect the right solutions, and those solutions are things about embracing public health. It's such a fundamental, important thing for kids. Having a measles epidemic is not progress. We should be going the other direction. Um, I also think that Kentucky is often in policies really shown some innovation, and has been, I think sometimes, like, I grew up in El Paso, Texas, and I would say sometimes um, in settings like that, um, there's a lack of resources. In fact, in like El Paso, it's a very poor community, that sometimes you're more innovative. And so I think some of the things that Kentucky can really think about are, how do you connect health systems to other settings, right? So is there ways to improve school health? Is there the Head Start program provides health services? What about childcare centers? Those are also places where there's food. And so are those the kinds of things, can we do both health and nutrition better in other settings, and where the kids are? Like, those are where the kids are. So can we provide those services there instead of taking steps backwards, right? Like the administration, again, just cut $1 billion out of children's mental health. That's the wrong direction. And then another thing I would say that I would hope that Kentucky would think about exploring is, it's really, can we provide supports to families? And so, like, if someone's eligible for SNAP, by definition, a child is eligible for Medicaid. So is there ways to do sort of this concept of express lane, where you basically say, if the state agency already knows that someone has low income, can't you just pre-populate the forms and help get these families, kids, enrolled in healthcare services? So, like, those kinds of things I think would be really innovative, and are ways to sort of help families rather than create barriers, and also, and be partners with families, as opposed to, again, the atomization of families and basically the separation and pushback, and making them do their own research. Like, I'm sorry, I have 4 kids. I'm not a medical doctor. I relied on my pediatrician, and that's what we should be doing.
Yeah, most parents don't have a lot of time to dig into the academic research and pull the literature and make an informed decision based on their own analysis. So,
Right.
what I'm hearing from all of you all is that there are some big opportunities at play. Us being able to focus on kids and kids being part of the conversation is really hopeful, and it creates some opportunities, at least in Kentucky, but hopefully on the national level as well, to start focusing in on what's important for our kids and families, and what is meaningful and they need in the coming years ahead, and meeting them where they are, Bruce, like you said, whether it's at school, at childcare centers, out in the community. So I'm feeling hopeful that this conversation will continue on the national and state level, and really get us towards clear solutions and evidence-informed, science-based solutions, things that we know work, and investing in the things that create those good outcomes that we have seen in previous years. But I just wanted to start off by saying, or we'll finish up by saying, thank you to Bruce, Lesley, and Allison Adams and Alicia Whatley for today's conversations. Again, Kentucky's task force and the national task force, there's some similarities, but I think there's some differences. I think in Kentucky, they're spending a lot of time listening from the experts, and I'm grateful for that. And I hope that maybe the national work will engage experts more comprehensively in the future. We encourage our listeners to stay plugged into KYA and the Foundation for Healthy Kentucky, as well as First Focus, for updates on the impact of the MAHA agenda on kids' health and well-being, and for ways to take action in the 2026 Kentucky General Assembly as we head into that in January and see what the impacts will be from those national and local conversations. And as always, thank you to our listeners for tuning into another episode of the Making Kids Count podcast. Thanks so much.
Thank you for listening to the Making Kids Count podcast. For more information and to listen to more episodes, visit kyouth.org/podcast. To support this podcast and our mission as the independent voice for Kentucky kids, please consider making a gift at kyouth.org/donate.